What I have here in front of me are common drug paraphernalia that are associated with injecting of prescription medication pills such as Percocet, oxycodone, and heroin. Starting right to left here, I have Reynolds heavy-duty aluminum foil. A lot of times people that aren't aware of drug culture or what's going on with use of drugs ask me, what does aluminum foil have to do with drug use? What we usually see is heroin's commonly packaged for sale on the street in aluminum foil. A lot of times they're small aluminum foils like this, maybe 2 inches by 1 inch, and once it's packaged up in the packaging, it's about this small, usually about half the size of a pinky nail. That would be approximately $50 worth of heroin that we would buy off the streets in Fond du Lac. Here, this is a tube containing 3 syringes, preloaded syringes with Narcan. On the front of this it says naloxone. That's just another name for Narcan. This is what the common Narcan needle looks like. Here's alcohol prep pads. These are given out through the needle exchange. Along with some of these other items, which I'll be getting to. They use these to clean the areas before injecting. This is a sealed up 27 gauge half cc needle that's commonly used for injecting heroin or prescription medications. Similar to what would be obtained through the needle exchange clinic. Here, these are what are referred to as cooker cups. They look like little tea light candle cups. You can see the bottom of this one is charred. That's because this one was already used at some point in time to cook up heroin or prescription pills to be injected. That's where the charring comes in on the bottom that's where a lighter is used to heat up the solution to inject heroin or prescription pills. This is what they look like before they're used. You can see this one was modified a little bit to have a little handle on it. Here in front of me I have a spoon. You can see a little bit of charring on the bottom of this. There's a whitish blue residue on it, and in the middle of it here is a little cotton ball that's used. What happens is users will put heroin or prescription medications in this spoon crushed up, add a little water to it, heat it up, mix it around, and they put the needle into the cotton ball. They pull up the solution, which includes the drug, through the cotton ball, which acts like a filter to get any dirt or anything out of the solution, so it isn't pulled up in the needle to be injected. This is a rubber tie-off, commonly obtained through the needle exchanges. It's no different than what you'd see at a hospital when you give blood. A lot of times anything that can be used as a tie-off, common items are belts, shoelaces, things of that nature. What I have here are mini cotton balls, also which are obtained through the needle exchange clinic. You see they're very small, and they're used as filters when loading a needle with the solution. This in front of me is what's known as Dorman. It's a nighttime sleep aid. Dorman, for what I have seen on the streets in Fond du Lac, is a common cutting agent for heroin. A lot of times people will use Dorman and other sleep aids as a cutting agent to maximize their profit with dealing with heroin, and it makes the potency of heroin go down, and they can sell more of their product. This is a tube of used syringes. They're half cc syringes, just like this one that I showed you. These are just out of the packaging. These were actually taken from an old case, and they were all used syringes. These are common drug paraphernalia that we'd find anywhere in Fond du Lac when we were working drug cases.